Hi, I'm Dr. Rinku Mehra, founder of the Mehra Clinic. I'd like to talk about the difference between type 1 and type 2 diabetes because I often get asked this question in my office. I treat both of these conditions, and I think it's important to understand the difference between the two. Type 1 diabetes has usually been called juvenile onset diabetes. Usually, this type of diabetes is diagnosed in young children. The signs and symptoms come on suddenly. For example, they have sudden increase in thirst and urination. They have sudden onset of weight loss. They're drinking frequently and waking up in the middle of the night to pee or getting up in the middle of the night to go to the bathroom. In a child that has been toilet trained, they suddenly are wetting the bed. If this happens, these children can become sick very quickly and need to go to the hospital. If you think your child has symptoms of type 1 diabetes, usually the symptoms develop over weeks or months, not years. And this needs emergent or urgent attention. Type 2 diabetes, on the other hand, is a condition that traditionally was called adult onset diabetes. It occurred in adults, but more recently we have seen the onset of type 2 diabetes in younger children due to the obesity epidemic. Usually type 2 diabetes takes years to develop. Children can also have similar signs and symptoms. They're drinking a lot, they're going to the bathroom frequently, they can have frequent infections such as candidal or yeast infections, and they usually are overweight. Often they have signs of increased insulin resistance, like darkening in the back of their neck, under their arm, or in young girls under their breast tissue. Treatment of type 2 diabetes includes changing diet, exercise, and sometimes oral medication or insulin. Treatment of type 1 diabetes includes treatment with insulin only, as insulin is required to make these children stay healthy and to control their blood sugars. Oral medication often is not first line for type 1 diabetes, whereas it is for type 2 diabetes. If you have more questions and concerns about type 1 or type 2 diabetes, as these are conditions I treat commonly in my clinic, please contact me at themehraclinic.com.